So my name is Dr. Aaron Avery. I'm from I practice out in Fairhope, Alabama. I just had experience really restoring them in my office. Hadn't done any implant placement yet, but was definitely something that I wanted to do. It's a need for our patients, and I love this. More the pros focus, full mouth restorative dentistry. That's the dentistry I love to practice in my office, and implants are a really big part of that. So I'm excited to be able to start introducing that with my patients and giving them a lot more and better options to restore their smile and their function. I had done a sedation course in February with docs, and at that time was already thinking on doing implants, and had arranged another course. And there was a presentation that Dr. Chaffin and Dr. Brown had presented one of the evenings of doc sedation, and they gave a fantastic course. I went in there I was expecting some free food, maybe learn a little bit about some implants, and they gave a phenomenal presentation, just really talking this course up and what we're going to be able to do here. And after that presentation, my mind was sold. I said, sign me up, let's do this. And this was every bit of what I was expecting, but they talked it up, and I'm fully happy with what had gone on here. But I had a good idea what I was coming into when I had signed up, which is why I'm here. So I'm up to 22 implants right now. This morning was great. My butt has been kicked just over these last few days. Today was amazing, but we're up to 22. I did a surgery this morning. Full extractions on the lowers, and 6 implants. Some were immediate of that, some were fresh. I've been doing immediate and fresh all week long here, but it was a great case. At this point we're winding down on our last day, and I had the confidence to go in there and I put all those implants on my own with really not much oversight at all. The doctors, I'm very confident in what I'm doing. They're confident in my abilities. So, we went in there and got it done. Everything went beautifully and perfect. And it's nice having that confidence to do something like that. When I came here, I knew we were going to be doing, full arch, full mouth. But I think a lot of doctors, are just even struggle with a single implant placement. So to be able to go in and do 6 implants for overdentures or FP1s, 2s, hybrids was an amazing experience. And again, that's the kind of dentistry that I love, and I can't wait to get back and bring that to my patients. So so we covered a lot of information while we were here at the Institute. The thing that resonated to me the most would have just been the differentiation between like FP1, FP2, hybrids, and really more of a fixed prosthetic approach to a full mouth restorations. So again, this is the kind of stuff that I love to do, and I know a lot of general dentists, they're a little more timid and shy. I see that a lot just with dentists, and I love this field, and I love to learn more and do more. And I think you just got to find the right guys and the right training. But Dr. Chaffin and Dr. Brown have given me a phenomenal foundation to really, I don't know, I wouldn't say that I feel like I'm ready for those cases, but they have more courses even from here to really be super confident in restoring those smiles with the lab and the prosthetics approach. There's much more than just throwing 6 implants down and calling it a day. But they're a great resource, and letting us know what we don't know what we don't know, and showing us the steps to get there. But for me, the biggest thing that we covered is really just the FP1s, FP2s, and I can't wait to get back and start doing that. And that's what's great about here is you see so many dentists just wanting to do these hybrid dentures, the hybrid fixed prosthetics, the FP3s, where they're just whacking off a bunch of bone, which is really a disservice to the patient. So being able to make those differentiations between the FP1s, where we can actually preserve a lot of the bone, which is going to be so much better for our patients, and even get them what I'd say is even a better smile than what that hybrid would have been to begin with, because we're maintaining that natural tissue and keeping them in a lot of good bone. The atmosphere here has been absolutely incredible the whole weekend. I think there's about another 7 doctors here with me, 6, 7 docs, and a lot of clinical instructors, even beyond Dr. Chaffin and Dr. Brown. We've had some phenomenal people that have been through this institute before that have come back now as faculty. And the atmosphere is great. The doctors here are all, it's like a family here, and I have every bit of confidence. If I need something, it's, I can pull in Dr. Brown, Dr. Chafin, ask him questions. But it's really been a great learning atmosphere. I feel, confident asking anything that I need to. But it's been great. I would 100% recommend this course to absolutely anybody. I think this is going to be very quickly becoming one of the top implant institutes to get trained in America. There's not a lot of opportunity I see here to really get this much surgical experience. So the other course that I was looking at doing was more just a lot of didactic coursework and not so much the physical placement. So to come in here, be able to get that much, 22 implants, and we're not even done, and so, and doctor, I think we had planned on, when I signed up, 17 implants, and it's not even, so much the amount of implants. I have great surgical experience at this point. We did sinus bumps, bone grafting, immediate implants, fresh implants, and preparing patients for FP1s, overdentures, and even just anterior restorations. We have literally covered about every gamut of implant dentistry. We went over cone beams, and even I'm lucky I inherited a cone beam with my office, but even these doctors that don't have them, just with PAs and panos, I think we have a lot of confidence, even just placing implants with that limited information, which is great. But no, yeah, jump in this course. You will not regret it. Dr. Chaffin and Dr. Brown have got me for life, and I will give them every dollar as long as they keep this program going, and I can't wait to learn more and grow with them. I feel very comfortable, continuing to advance my education in this area with Dr. Brown and Dr. Chafin as my guide and mentors in that area.